a situation and carry the message he has. So this is the effect of spinal disorders in low and middle income communities, the status of non-surgical care in Africa. So the impact of spinal care around the world. Why do we care about spinal disorders and in underserved communities? Is it personal or is it the numbers? This is a patient from Mahalape, a 36-year-old hospital employee who was happily married with 2 children who were in school before onset of the spine pain. She presents to the World Spine Care Clinic in Botswana over a 10-year history of low back pain that expanded to encompass the entire spine. She could not care for herself. She needs to help go to the toilet, to bathe, to bend over. She could not make love to her husband. Her husband was unable to take care of her and their children, and he had to leave. She moves in with her family, who now has to take care of her and her children. She's unable to work in the hospital and loses her job, and she stops paying taxes. She has some difficulty. There's no workers' compensation in this particular situation. She tries to start her business making jewelry at home to survive, but she could not travel to sell her jewelry. She could not take care of her children or clean her home. She does not have the funds to do those extra things to send her kids to private school as she had hoped. The impact, therefore, of this person, the spine pain of this person, is that the employer loses a skilled employee. Her husband loses the additional financial support necessary for his family and companionship as well as conjugal relations. The children at this particular session had difficulty going to school. The family is stressed by having additional 3 people to care for, and the government loses tax revenue. This extends far beyond somebody having some pain. Now I want you to think about this and expand it to 1 billion people in the world, according to the WHO, that have disability. And think about who suffers the most. Poorer countries, lower income countries suffer considerably greater from spinal problems and disability than high income countries. Women suffer far more than men. The elderly or the older population suffers much more than the younger population. Rural population suffers much more than the urban population. And the lowest quintile of the financial quintile of the population suffers much more than the highest quintile. And arthritis, rheumatism, and back pain are the major causes of disability. And these people who have disability have poorer health, lower educational status, and fewer economic relations. It's now being considered the 21st century global epidemic. If we look at the data from Africa and around the world, this is a recent paper, came out last year, reviewed the world's statistics. Point prevalence in the general world population is 18%, but the point prevalence in Africa is 32%. The 12 months prevalence is 8. That's how many people in 12 months have back pain, is 38% in the world, but in Africa it's 50%. And in workers in Africa and lower middle income countries, it is as high as 52%. The global prevalence of spinal disorders is therefore such that back pain is the #1 cause of disability, and neck pain is the #6 cause of disability. Most is non-specific, it's persistent and episodic. 85% of the population, 85% of the people in this audience will have back pain in their lifetime. And it's increasingly recognized now around the world as important. This is a reiteration that the 1-year prevalence of low back pain in adolescents is 33. That does not affect, this is his point, does not affect only the elderly or not only workers. But if we look at adolescents, up to 1/3 of adolescents and children also develop spine problems which can interfere with their activities. It's widespread, it affects national economies. In Switzerland, it now is impacted by 2.1% of gross national product, local economies, workforce and business, and family and community impact. And we're talking about the tip of the iceberg. Now there's an issue of, is it just back pain or is there something more? I'm going to do this very rapidly. We're talking about comorbidities, things that go along or are associated with back pain. Lack of ability to work and lack of ability to do things. In Africa, Africa now has 14% of the world population. I just got back from the Skull World Forum where they estimate there'll be 1 billion people in Africa within the next 25 years. It disproportionately is a burden of health, and only 4 out of 25 of the poorest countries in the world are not African. Causal relationship between income and health has been well established, and spinal disorders are not prioritized, except here in Botswana, in any other country in the world, any other of the poorer countries in the world. Back pain right now is more important, has a greater burden than HIV/AIDS, Alzheimer's disease, malaria, lower respiratory infections, breast and lung cancer combined, diabetes, depression, or stroke. And some data we have, these statistics, I'm not going to spend a lot of time, but there's a series of graphs. On the left side is what this is liver disease in the general population, then in people with back or neck pain, then with people with severe back and neck pain, then with people with persistent back and neck pain, and those with severe persistent back and neck pain. And you can see a close relationship between liver disease and back pain. And you can see it with kidney disease, with diabetes, with depression and anxiety. And recent data has shown that people with back pain have a 13% all-cause reduction, increase in mortality over their lives. So people who have that, doesn't mean that back pain is killing everybody, but the associated disorders, the disorders associated with it, if you have back pain, you have a 13% increase in mortality. So the social determinants of health are social, political, environmental, economic. It's an aging population. It gets worse as we age, as I mentioned before. Expanding, and we're all expanding in Africa, especially as we control the communicable diseases. It's the WHO now has an integrated care for older people, which incorporates the spine care and musculoskeletal disease now. It's focused on functional capacity, keeping people active, functioning, and participating in the community, and physical activity. The impact in low and middle income countries is the key, is that we have to have key interventions and educate local community. There's no way a charity outside the country can do anything more than educate and provide guidance and access to low care, primary care, so that it can be done in the communities. There are difficulties in managing spinal disorders in low and middle income countries. A recent paper just showed, so I'm just recovering from a cold, I'm so sorry. Thank you, Margaret. A recent paper just reviewed how much time doctors spend with their patients in different countries of the world. 50% of the global population spend 5 minutes or less with their doctors. And in Tanzania, it's 3.8. In China, it's only 2 minutes. In Bangladesh, it's only 1 minute. And you cannot give good care to a patient if you're only spending 5 minutes with a patient, and especially spine care. We have, when you have these short time with a patient, you actually tend to give more drugs and more because it's quick. So you have polypharmacy with all of its problems. You have higher hospital admission rates because people are sent straight to the hospital rather than taking care in the community. You have overuse of antibiotics and other drugs, and poor communication. We also have limited healthcare providers in most poor countries and low-income countries, doctors, nurses, and surgeons, and limited understanding and education on the latest guidelines and methods of evaluating spinal disorders. This is the model which we do not want to have, where in the community you have doctors, nurses, people without understanding and confidence in how to manage spinal disorders. They send it into a district hospital who also does not have the facilities or the education, and they send it to a tertiary hospital, which is the most expensive way of taking care of people with spine problems and also the least effective. The third thing is that in these countries we have a higher incidence of serious disease occurring with spinal disorders, things like spinal cord injuries, serious pathology, and these are the various pathologies which I'm not going to describe. Non-surgical care. The majority of spinal disorders are not suitable for surgery, and we're going to learn a lot about that during this 2 days. The key management of spinal disorders is patient empowerment and education of community workers, and the primary spine care workers can focus on keeping people moving and addressing risk factors early. Working in the community is absolutely crucial. Dr. Brown's summary slide is that we have to address the burden of spine care disorders in Africa, and that such address has to be centrally resourced, community-focused, and patient-centered. The benefits of international initiatives such as ICOP must be communicated from the top down, and tackling the burden of spinal disorders as an emergency NCD must be prioritized to improve the health of nations. Thank you so very much.